Bismillahirrahmanirrahim. Today I will discuss hypoxia. First of all, you should know about hypoxia. What is hypoxia? Hypoxia means when there is lack of oxygen in the body tissues, so we call it hypoxia. Or there is insufficient supply of oxygen to the body tissue, so we call it hypoxia. There are certain conditions due to which hypoxia occurs. Number one is low level of oxygen level in environment. How? If a person go to the higher altitude, there will be atmospheric pressure but low. Due to low level of atmospheric pressure and oxygen inhalation will be less. Number two is respiratory conditions like asthma, COPD, pneumonia. These are very serious conditions that lead to hypoxia. Cardiovascular problems, heart failure, heart attacks. These are very common problems due to which most of the time hypoxia occur. Conditions like blood circulation disorders like shock and blood clotting disorders like can impair oxygen delivery to the body tissues. And fourth one is anemia. What is anemia? When there is a low level of red blood cell in the body, so our blood is called anemia. Or there is low level of Hb level, which can limit the blood ability to carry oxygen to the body tissues. Oxygen is very necessary for the body to produce energy, to produce energy and to induce various chemical reactions. Number fifth one is carbon monoxide poisoning. This is also occurred when there is inhaled carbon monoxide. What happens? It impair the oxygen binding to the Hb. It means that hemoglobin molecule can carry 4 oxygen. Okay, so what does it does? Carbon monoxide prevents the oxygen binding to the hemoglobin, due to which hypoxia occurs. There are certain neurological conditions like stroke. When there is blood supply impaired to the brain, so we call it stroke. And stroke has also some certain types due to which breathing is impaired and lead to hypoxia. Sleep apnea, the 7th number, when there is interruptions of breathing. How? If a person is sleeping, then and during sleeping, uh, if there is breathing is impaired, interrupted by some reasons, due to which sleep apnea, we call it sleep apnea. At one reason is carbon dioxide retention. When there is retained higher level of carbon dioxide in the blood, so what happens in chronic hypoventilation syndrome? There is accumulation of carbon dioxide in the blood, which interrupt the oxygen delivery to the blood and body tissues. So These are few reasons due to which hypoxia occurred. Thank you very much. Next lecture will be uploaded very soon, inshallah.